Did you know that Thursday was a special day?
I missed that, I'm afraid. What was it?
It was Global Handwashing Day.
That's ironic. The coronavirus has made every day hand-washing day.
No kidding. Global Handwashing Day is supposed to be a yearly reminder that washing your hands regularly is one of the best things you can do to avoid getting sick and passing along germs to other people.
That's a message that bears repeating, especially these days.
True. The coronavirus pandemic was a real wake-up call. I'm a hardcore hand washer now.
To be honest, at first, I wondered how such a simple, low-tech thing like washing your hands could make a significant difference health-wise. But once the coronavirus started spreading, I realized how crucial it is to regularly wash your hands well with soap and water.
Yes, indeed. Many germs that can make people sick are spread when we don't take that simple, common-sense step.
When you're on the go, though, alcohol-based sanitizers are great alternatives to soap and water.
And you should also remember to try not to touch your mouth, nose, and eyes with your hands. That can be very hard to do, admittedly.
I've made it a rule to wash my hands before I leave the house and when I arrive at my destination, to wash off germs I may have picked up from doorknobs, elevator buttons, or other surfaces. It's also important to wash your hands after you handle uncooked food. Unwashed hands can pass along germs from infected raw meat or eggs.
Most of us knew about the menace of eating food infected with E. coli bacteria, but we also can get sick from touching any surface that's tainted with a virus.
And, of course, you should give your hands a good wash before you sit down to eat. Most people spend only a few seconds washing their hands. 20 seconds is what's recommended, or the length of the happy birthday song sung twice.
Many people, including yours truly, no longer shake hands when they meet someone. To protect yourself, limit your contact with others.
Hands are home to thousands of germs, including bacteria and viruses.
I take that to heart. In Japan, we bow to each other instead.
I'm glad you do. And don't get me started on the embarrassingly messy peck-on-the-cheek greeting that some of my colleagues and acquaintances had embraced.
But tell me, what should you say when you don't want to shake hands with someone for fear of infection?
You can try something like, "Excuse me for not shaking your hand, but I'm following the CDC's recommendation that we limit personal contact to help prevent the spread of the coronavirus."
Many establishments now prominently post rules mandating face masks and hand sanitizer use and limit the number of customers allowed inside at one time, as well as conduct temperature checks. Only a few months ago, measures like these would have been considered excessive.
But now it's seen as essential to protect human health.
I always keep a mask handy and wear one in enclosed spaces when I shop or anytime I'm in close contact with people from outside my household.
There was initially debate over whether face masks are effective in stemming transmission of the coronavirus. Now, few people doubt it. In fact, face masks have become a symbol of our times, a symbol of the current confusion and fear. Shota, people in Japan are used to wearing masks, aren't they?
That's right. I never thought I'd live to see so many Americans, heck, so much of all humanity, wearing masks. When I worked as a part-time student tour guide to foreign tourists in Japan, one of the most frequently asked questions was, why are those people over there wearing masks? Do they have a contagious disease? It's been a common sight in winter and spring in Japan for a long time.
Perhaps we'll reach the point where wearing a mask will be seen as a sign of self-care and a gesture of thoughtfulness for others, as it is in Asia, not a sign of fear and confusion.
We may see a new wave of the coronavirus outbreak, so some doctors want us to consider another layer of personal protective equipment in our daily lives, clear plastic face shields.
Face shields have long been required equipment for many procedures in hospitals. Doctors and nurses wear them when intubating COVID-19 patients and during surgeries that may cause blood and bone fragments to fly out. But I hope we won't get to that point in our daily living.
We often hear about the frontline heroes, doctors, nurses, technicians, and other healthcare professionals treating people with COVID-19. We should also remember another type of hero, often unsung, the essential worker. People like grocery store clerks, delivery drivers, food service providers, and mail carriers put their lives at risk each day to help us meet our needs.
Yes, many Americans are finding ways to thank essential workers for their bravery and sacrifice.
All our heroes should be recognized and supported, however possible. The Latin restaurant I'm consulting with is arranging for food to be sent to workers at care centers, hospitals, clinics, and shelters in Manhattan.
That's great, Nancy. When I stopped at a fast food restaurant last weekend, I saw an elderly gentleman hand the cashier an extra $50 to cover the cost of the meal for the next healthcare provider or first responder who came through. I thought that was a wonderful way to acknowledge all that they do for us.
You know, one thing that's bothered me is the myths about the coronavirus that have spread on social media. It's not true, for example, that there are specific foods that prevent infection. Let's make sure we're getting our information from qualified experts and basing our decisions on that.